So thank you very much. So this is sort of round two of our session on SIREN. So we're going to have our speakers today are going to be talking about sort of moving to the next. We had a historical perspective. We had the big picture of SIREN. And so now we're going to begin with Cliff Callaway, who's going to talk to us about how can I get involved in SIREN.
Great, so thank you. I have to do the obligatory conflicts there. The question is, how do you get involved if you're not involved already? So that may be a reason some of you are here. I'm going to throw out some ideas and talk about that. And then again, I think at the end, when we have question and answer, you can drill down on things that might be ways for you to become part of the network. So first thing is join a working group. And this is a concept, the working group, that has developed in NET and has been very successful. So what's a working group? Now this is a group of investigators with a particular interest. We've listed what some of the potential working groups are, and some of these are groups that already exist because of continuity with NET, ROC, people who've come before. I highlighted human subjects protection, the HSP working group, because it's been particularly successful and productive, I think, in the NET experience. For example, here is the PROTECT trial. You remember this well. It's a large clinical trial, progesterone and traumatic brain injury, but there was the Human Subjects Protection Working Group, and there were opportunities to study things about EFIC and informed consent and the enrollment of patients in emergency research. And that group generated a lot of secondary studies or studies done in parallel or ancillary studies, however you want to choose to describe them, because of our access as a network to all of the subjects who are going to be in this trial, plus all of the things that the IRBs were doing and the sites were doing as they did this EFIC trial. So that's an example of what a working group can do. And I had listed there a variety of things: critical care interest, EMS interest, various aspects of emergency cardiovascular care. So you can imagine for any of the trials that are upcoming, you might have a particular topic area, and you can find like-minded investigators and do this kind of work for a few dollars more. Really, the few dollars more is your labor and sweat to actually collect the information as the trial is ongoing. So if you have an idea and you say, geez, I wish I had been there when they were designing the BOOST trial, and I had had my idea that if we had only studied how people feel the pain of having had a burr hole, and I really think that's going to create chronic pain for that person, well, lo and behold, you might actually be the person in the critical care interest group who can track down all those people and ask them, hey, does that burr hole hurt? That's a example of how this idea might not require a grant, but can be a way to be involved in the large trial. So if you're not involved, how come not? Everybody can be a spoke. So Hobbit is hard. You needed a hyperbaric chamber. Boost, perhaps you don't do neurocritical care for that. But look at the trials that are coming up. Chest pain, low-risk chest pain in the emergency department. If you work in an emergency department, you can be a spoke. This is a question we all ask every day, and the enrollment of people is low impact, and we really should become a spoke for these trials. Likewise, cardiac arrest is a common disease, and what your hospital does or what the disposition of hospital does may make those patients eligible for ISCAP. Now the spokes are where it's at. This is where the action is in the clinical trials. It's where the enrollment happens. So all of the other infrastructure in SIREN is there to support the spokes. You don't have to be already at an academic center who was one of the named hubs. There they are. Those are contractual arrangements to take Jeremy's money and spread it out to all of us, and that's really the way that should function. Plus, the hubs have some reporting requirements and should be doing some things for support and helping enrollment at the participating spokes. But you can be a spoke. So if you're not a spoke, why not? Develop ancillary studies. We heard about this and we talked about it. I was sweating because I thought my slide would be irrelevant, but it's probably worth mentioning a couple of times. There is the parent study with the large grants that goes to the core investigative team. Ancillary studies or sub-studies are well defined. It involves collection of additional data, specimens, or records. You're going to have to spend treasure or time in order to pull it off. You probably need a secondary grant. To do it, you need to coordinate with the core parent grant, and we heard about mechanisms to do it. Pitch an idea. If you think that's a good idea, there are multiple points of entry. We mentioned you could talk to anybody at the coordinating centers or NIH leadership. We'll help you assess the feasibility and help with the budget and logistics and strategy to advance the grant. But it's really, really critical to talk to the primary trial PIs, because those are the people most vested scientifically in each of the trials that's going forward. So your ancillary study needs to be consistent with their goals. Let's give an example also from NET of a successful ancillary trial. The SHINE trial, ongoing now, 1,400 patients or so with stroke being treated with IV insulin or sub-Q insulin. It has a parent grant at UVA. This ancillary trial, Nina Gentile at Temple has brought forward its iSpot to look at particular blood markers in the patients who are enrolled in SHINE. So that is a great example of two grants, large grants, enrolling the same patients, and they became integrated well with the network. So when you consent somebody to be in SHINE, they don't have to do a separate consent form for iSpot. They just check a box that says, yes, I also consent for my blood to go ultimately to Temple for this other study. So it's low impact on the subjects, value added for the science, and is supporting two large U grants. Join writing groups. So the trial's done. There's going to be publications. The primary paper is going to be driven by the people who put together the original trial and the parent trial. But, you know, those data are your tax dollars at work. So the core investigators have dibs on the parent study. They also have some right to look at the publications. And we have posted our publications policies for the networks on our website. We really would look at the core investigators having some rights on the data for the first year, but public use data sets will become available. And other ideas you might have to analyze the data would be things you could approach the investigative team, even if you weren't there at the very beginning, to say, you know, I think we could analyze it this way, or, you know, perhaps the public use data set I can obtain and we can do a secondary analysis. Look, there's some there. Pre-hospital intubation associated with favorable outcomes and lower mortality. I think this was a analysis. I don't know if this was on the public use data set or a secondary analysis done within the. Yep, I'm seeing nods from within the network. Proposed new writing groups. So for primary, secondary papers, again, you're going to have to follow the publication guidelines of that trial. But the tertiary, quaternary papers, absolutely, that's your intellectual effort going there. And then advancing new trial ideas. Again, the points of contact are the coordinating centers and the project officers, and sometimes your ideas might be not quite ready for the large phase 3 trial. Maybe it needs a phase 2 trial. And after my experience with ROC and previous, I think the loosening of the idea that we can get into the space of early trials in order to have a good pipeline of research that comes into the huge network is great, because a lot of our ideas need a little more data to know what the feasibility, the variability, what kind of sample size we'll need for a definitive trial. And we want to play in that, and this group of investigators, I think, is the community that can help you design and execute those trials. So look, how you get involved: working groups, be a spoke, develop ancillary studies, join a writing group, secondary writing groups, and advance new trial ideas. I think it's a lot of ways that you can be part of the network. All of this, and if you want to do one of these things, should be on our website, including the working groups. So that's the place to go to find out more. I'll stop there. Thank you, guys.